The next stage of the abdominal examination is palpation. Before you do so, inform the patient that you will be pressing over their bladder, and if necessary, ask them to visit the loo first. Begin with light palpation. By doing so, you introduce contact with the patient, and it is the least invasive. It is advisable to start from an area furthest away from any tenderness. Also ensure that your hands are warm and that you frequently watch their face for signs of undue discomfort. In some cases, the patient may be tense and may need some reassurance from you to voluntarily relax their muscles. It may also help if you place a pillow under their knees. Place your fingers together and almost parallel to the skin. Apply light, deep motion and move from place to place by raising your fingers off the skin. Adopt a systematic method so that you ensure coverage of all the abdominal wall. You may, for instance, start at the epigastric region and work your way around clockwise. The purpose of light palpation is to feel for abdominal tenderness, superficial organs, and for muscular resistance. Now repeat the procedure with deep palpation. Use reasonably firm pressure and examine all 4 quadrants. You may want to use both hands, one on top of the other, especially in the obese. Apply pressure with the top hand whilst feeling with the one in contact. With deep palpation, you attempt to identify any masses and their qualities. That is their location, size, consistency, shape, if they are regular or irregular, smooth or rough, evidence of tenderness, whether it's pulsatile, mobile or fixed, and whether you can get your palpating hand above or below the mass. If you have found any areas of tenderness, you will need to assess for peritoneal inflammation. There are 2 methods for this, either by rebound tenderness or by coughing. For rebound tenderness, place a firm but slow pressure with your fingers on the patient's abdomen and then quickly lift them off. Watch the patient's face for obvious signs of discomfort as you withdraw. Alternatively, place your hand firmly on that area and ask the patient to cough to assess if that was painful. Now I'm going to press again. Are there any areas which are tender at the moment?
No.
Cough for me. Again. Good. Again. And again. Thank you. If the patient has experienced pain on coughing, has rebound tenderness, or is sensitive to percussion, then this suggests peritonitis, an inflamed peritoneal membrane. There may also be guarding and rigidity of the abdominal wall. The next stage is to palpate each of the organs, the liver, spleen, and kidneys. The liver is located in the right upper quadrant, mostly in the right hypochondriac region. In the normal slim person, you may only be able to feel the inferior edge of the liver. It will protrude as a soft, smooth structure under the right costal margin. Remember that when breathing in, the diaphragm descends and pushes the liver downwards, and the reverse when breathing out. Place your flat hand either parallel to the rib margin or with the fingers projecting superiorly just below the rib margin. Ask the patient to take a deep breath. Reduce the pressure if necessary to allow the liver margin to slip under your fingertips. Assess its texture. A normal liver has a smooth, regular surface. An enlarged liver will project towards the umbilicus. If you cannot palpate the liver, think of the possibilities of atrophy and fibrosis. But bear in mind that in many instances, you may not be able to feel the normal liver. If you suspect gallbladder disease, then you need to be gentle as it may be tender. Murphy's sign is pain experienced over the gallbladder when pressure is applied on it. Remember that the gallbladder may also radiate the pain over the right shoulder region. Now palpate the spleen. The spleen is located under the left costal margin and it is not normally palpable. When it enlarges, it projects towards the umbilicus. Use a similar palpating technique to that of the liver. Apply gentle pressure. Ask the patient to take deep breaths in and try to feel for the soft, smooth edge of the descending spleen. If it is not palpable with inspiration, then move progressively closer to the costal margin. Now we assess the kidneys. Note the kidneys cannot easily be palpated, even in a slim person. To feel for the kidneys, you need to use both hands. With the one hand on the back of the patient under the 12th rib, pushing upwards, and the dominant hand pushing down just below the costal margin. Ask the patient to take deep breaths in to help descend the kidney as you attempt to trap it between your two hands. The enlarged kidney may be felt as you try to capture it between your two hands during inspiration. If you are able to palpate the kidneys, try to describe their texture and size. They are usually tender in hydronephrosis or when acutely infected in pyelonephritis. Another method for assessing kidney tenderness is to percuss over them. One particular technique is to perform the kidney punch. Place one of your hands posteriorly flat over the kidney, and with the fist of the other hand, tap firmly your flat hand hard enough to set off a vibration. Was that painful to the patient? Examination of the gastrointestinal system must include palpation of the lymph nodes. Pay particular attention to the supraclavicular lymph nodes. Note the presence of Vercoe's node. This is a palpable left supraclavicular lymph node, which may signify gastrointestinal malignancy, especially of the stomach. It is also advisable to palpate the femoral arteries. Check for radiofemoral delay and, if indicated, palpate the abdominal aorta. Give me your hand.